Hi everyone, my name is Lou Ann Bailey. I'm an acute care nurse practitioner that has worked in cardiology. I was invited to CARPS to talk about non-invasive cardiac testing. I had the opportunity to speak to a wonderful group of advanced practice providers, both nurse practitioners and PAs, to talk about what kind of test is the right test for the right patient for the right reason when you're talking about suspected cardiovascular disease. I think the three take-home points we would like to discuss or remind people of is we want to look at the patient from a risk standpoint. We want to make sure that we evaluate them for their cardiovascular risk. And this could be easily done by using the cohort equation that we often can get on our phones, our smartphones, and actually share with the patient along the way. The second is we want to make sure we pick the right test. We want to make sure that if the test has been done before, we want to use the same test. However, if the patient is able to walk on a treadmill, an exercise stress test is really one of the best tests we can use to actually evaluate for ischemic disease. It is not only something to evaluate coronary disease, but it also could be prognostic and help us identify patients who are at risk. Additionally, this also will help identify patients who need to go to cardiac rehab to actually give them an exercise prescription. There are various types of stress testing that we can look at. And exercise stress testing, pharmacologic stress testing, myocardial perfusion stress testing are just a few that we want to take into consideration. Other non-invasive procedures can be our same old EKG and also our echocardiogram. We want to make sure we also look at guidelines from the American College of Cardiology, the American Heart Association, as well as using our up-to-date to kind of give us some idea of what we need to do for our patient. You need to remember to look at the patient and make sure you have the right patient for the right reason, having the right test to actually do the best evaluation for coronary artery disease.